The Office of the Auditor General of Ontario just dropped a report recently that reads less like oversight and more like a warning flare. Doctors billing more than 24 hours in a single day. Physicians billing all 365 days of the year. A tiny group collecting millions annually with limited follow-up and weak enforcement behind the scenes. Now, let's be clear. The vast majority of doctors in this province work hard and play by the rules. This is not an attack on frontline physicians. This is about a system that appears unable or unwilling to police itself. Because here's the real question. How does a private credit card company flag suspicious spending in seconds, but our publicly funded healthcare system pays first and asks questions later? Why are recoveries partial? Why do reviews take years? And why does oversight rely on complaints instead of modern fraud detection tools? It isn't just about billing, it's about trust. And when families can't find a family doctor, when ERs are overflowing, and when taxpayers are told there's never enough money, we deserve to know every dollar is protected.
We found that as of 2024, an estimated 2 million Ontarians, or about 12% of the population, did not have a primary care provider. Our audit found that the Ministry of Health and Ontario Health did not consistently have processes in place to plan or oversee programs and initiatives that are intended to improve patients' access to primary care providers. Our audit found that the province's centralized matching program, called Healthcare Connect, has not kept up with demand. The number of Ontarians on the waitlist as of January 2025 represented only 11% of the estimated number of Ontarians in need of a family practitioner. On Healthcare Connect, there were more than 108,000 people waiting for more than a year to be matched with a doctor. We also noted that there was a failure to coordinate physician recruitment at the provincial level, which has resulted in a fragmented and competitive approach to recruitment across the province. We examined the government's oversight of physician billings. We found that the ministry lacks a modernized payment system and is not using data analytics to detect potentially inappropriate physician billing. The Ministry of Health paid $19.5 billion to roughly 35,000 physicians in 2024-25 through the Ontario Health Insurance Plan, or OHIP system. The OHIP system, which has been in use since the 80s, cannot automatically flag potentially abnormal billings for further investigation. We found that a system modernization initiative announced in 2023 has been delayed and is awaiting approval by the government. We observed that the ministry relies primarily on tips and complaints to trigger post-payment audits. We observed that only 8 staff conduct post-payment audits, the same number as they did in 2017. In a 2024 analysis, the Ministry of Health noted that between 3 to 5% of fee-for-service claims that they reviewed had potential anomalies. And we calculated, using their percentage and the $13.3 billion in fee-for-service payments made that last year, that approximately $400 to $665 million could have these potential anomalies. Our analysis of fee-for-service billing data between 2021 and 2024 found numerous examples of potentially high-risk billings that were not audited by the ministry. This included physicians billing more than 24 hours a day, over 365 days in a year, billing for seeing more than 100 patients in a day, and where their overall billing was significantly higher than their peers. We recommended that the ministry utilize data analytic tools to flag these and other high-risk payments for review. The Ministry of Health agreed with all 19 of our recommendations. Next is a Supply Ontario PPE audit. Our audit noted that between 2021-22 and 2024-25, over 1 billion PPE items valued at approximately $1.4 billion were written off. At current rate of use, more of the stockpile is projected to expire in the coming years. We found that the province and Supply Ontario delayed disposing of unsafe inventory, or unusable inventory, Between 2023 and 25, they disposed of 780 million units through incineration. We made 6 recommendations, which Supply Ontario agreed with, including setting up an integrated inventory management system to track and report on PPE on a timely basis.
Okay, here are the 4 most striking findings from the recent audit of the Office of the Auditor General of Ontario regarding physician billing under OHIP. Physicians billed more than 24 hours in a single day was the first issue that came up. The audit identified cases where doctors submitted claims that exceeded 24 billable hours in one day. Some physicians also billed services all 365 days of the year. These patterns were flagged as high risk and implausible, yet not all were formally investigated. Here's another issue. Extremely high annual billings concentrated among a small group. Small number of physicians, especially in certain specialties such as pain management, billed several millions of dollars in a single year. The top earners billed amounts approaching $10 million annually. The ministry had limited evidence that all of these cases were subjected to a thorough review. Here's a major one: a weak and outdated oversight system. The Ministry of Health relies heavily on reactive measures such as complaints and tip-offs rather than proactive data and analytics to detect abnormal billing patterns. The billing review system was described as outdated and not fully effective at identifying inappropriate claims in real time. And the other major issue that the Auditor General's office found: limited recovery of improper payments. Even when questionable billing was identified, recovery of funds was inconsistent. In some cases, negotiated settlements resulted in the province recovering only a portion of the identified overpayments. Formal reviews can take years to conclude, reducing accountability and deterrence. These are all major flaws in our healthcare system. And by the way, none of those have anything to do with frontline workers such as nurses, healthcare professionals that help people in their homes, and all kinds of other parts of our healthcare system that are going to be affected when Ford makes these cuts.
The complexity of the treatment that some people get causes certain things to overlap with each other. So, for example, you might go in for one procedure which requires several different treatments for that one condition. So you have a condition, it requires several different treatments, and those treatments occur under various different billing codes. So there can be a considerable amount of overlap in that specific situation which you mentioned. But you should keep in mind, more importantly, that over the course of a year, there are approximately 200 million bills that get sent into the Ministry of Health in a typical year. Those are reviewed. 99% of them have no issues.
Now, instead of going after physician overbilling, the current changes Ford's government is moving toward are system-wide funding restraints, meaning less money flowing to the hospitals and public health, which affects nurses, staff, and patients directly. Government is tightening healthcare budgets, not targeting doctors' billing. Rather than saying we'll cut payments to doctors, the province has directed hospitals to plan for much smaller funding increases over the next few years, closer to 2% annually, which is well below rising costs. Hospitals can't cover rising costs, and with that, are cutting jobs and beds. In fact, hospitals are already cutting staff and beds. Unions report that at least 1,000 hospital workers have been laid off in regions like the GTA, Hamilton, and Ottawa. And facilities are already struggling with funding shortfalls. Staffing cuts like these directly affect patient care and capacity. And of course, more wait times and worse care is predicted. Analysis warned that these cuts could lead to longer wait times for surgery, rushed care, overcrowded hospitals, and a lack of enough staffed beds even before this future cut happens. Public health programs and services are also on the chopping block. Community health and public health units have faced funding reductions in the last few years already. And this will lead to cuts in services like disease prevention programs, sexual health clinics, outbreak response, clinic inspections, student nutrition programs, and on and on and on, all while abusive billing eats up millions and millions of dollars in our healthcare system. When I started this today, I was talking about overbilling, about the Auditor General flagging weaknesses in Ontario's oversight of physician payments. And let's be clear, accountability matters. Every public dollar should be tracked, audited, and justified. But what's happening now isn't a targeted crackdown on waste. It's a broad restraint. Hospitals are being told to tighten belts while costs rise, staffing remains short, and wait times are already stretched. If there are problems in the system, fix the problems. Modernize the billing system. Strengthen audits. Go after fraud where it exists. But don't quietly squeeze the front lines and call it reform. Healthcare isn't an accounting exercise. It's the difference between a staffed bed and a hallway stretcher, between timely surgery and months of waiting. And if we're going to cut, we better be honest about who's actually paying the price.